All right, let's talk about blanching. So blanching is when you press on the skin, it turns white and then red again. So why does this happen? The blood in the small vessels, the capillaries, gets pushed away. So push on your fingertip, it goes white, then pink again. That's blanching. So a blistering is a bubble filled with fluid between layers. When the deep layers get damaged, then fluid leaks out and it collects on the skin. So tight shoes, blisters. So in a question, you might see a guy burns his hand and it blanches. So what's the cause? It's histamine. Okay, so superficial stuff, it's red, causes blanching and it blisters. Deeper, it's red and it blisters. Very deep is white and charred. You have no pain. Why? Because the nerves are destroyed. Okay, so let's do a practice question together here. So a 30-year-old woman accidentally touches a hot curling iron and it causes some immediate pain on her fingertip. The area is red, warm, and blanches with pressure, and no blisters are forming, so it's not super deep. It's not deep. Within minutes, what's the cause of the skin change? Okay. So we know that the redness is going to be caused by the histamine, so the histamine is released from the mast cells. And so this patient has a superficial burn, only affecting the epidermis, the outer layer, and the redness and warmth happen because of the mast cells with histamine. The blanching means the capillaries are still intact because they turn white when they're pressed, they move out of the way, and then they come back. No blisters means it's deep. Fluid leakage would be deeper burns, activation of neutrophils would be much later down the line, and platelet aggregation and clot formation, no injury to the blood vessels, and fibroblast formation would be much, much later on. If this is helpful, like and subscribe.